Scotland twice. And I still came back sort of a bit confused about some of the concepts and everything like that. So if you're walking away from this a little bit confused, it may be my presentation style. It may also be that it's a little bit confused. And it is very different from what we're used to. In my experience, and what I've noticed is Tom Lynch, who developed RODBT, started off working with people, older people with depression, and trying to incorporate DBT strategies for them. He found it was not working. So 20 odd years ago, RODBT and DBT were the same thing. And then they went like this. And now it is a whole new ballgame. When I did my training, even back in 2015, the radically open aspect was an 8-week module to add on to DBT. We've now done away with all DBT, and it is now a 30-week program of its own. So it has continued to separate. It does have a lot of their core DBT principles, but it has become very different. So where this idea has come from is that there are a lot of people who aren't benefiting from the treatments that are out there. I love DBT. I'm DBT trained. I work in DBT primarily. I think it's fantastic, but it isn't one size fits all. There are people who don't quite fit with the model. And there are going to be people who aren't getting the treatment that they need. We know that even in the best efficacy studies, their improvement rates are not brilliant. So there are people who aren't getting the treatment that they need. 1 out of every 10 people in the community have a personality disorder, and over-controlled personality disorders are the most common. And so we do see borderline the most, and I think that that's important to be aware of. Borderline is the one that we hear about the most, it's the one that we see the most, it's the most visually eye-catching. They're the people who are more likely to end up in our emergency wards. They're more likely to end up in treatment, they're also more likely to have that conflict with their family and everyone around them, getting them into therapy. However, that's just one personality disorder. There are many others, and over-controlled ones are the most common. And for those, particularly when it manifests in clinical depression, the treatment isn't working for those. Because CBT, fantastic for depression, but a lot of people who are presenting with chronic long-term depression also have a coexisting personality disorder, which means that their depression is not getting adequately treated. So this is the idea that these are very chronic comorbid presentations that aren't getting the treatment that they need. Like I said, DBT, fantastic. But if people aren't fitting with that for their comorbidity, it's not necessarily going to work. Us as clinicians are more likely to come across a lot of different, not so clear-cut depression 10-session presentations. We're likely to come across these comorbid presentations quite frequently. So yes, RODBT is new in that it was only published, those manuals, just last year, but there's over 20 years research in this, and RODBT programs have been running initially starting off in the UK, but also in the US since for 10 to 15 years. There's a lot of research behind it. Tom very happily says that there is more research in RODBT before it was published than there was before Marsha published her DBT back in 1993. But, you know. So, to explain a little bit about this, and again, like I said, it's not as clear-cut as I'm going to try and make it sound. Self-control is our ability to, I suppose, save our resources for a rainy day. So self-control is a good thing. We see this as a really positive thing in society, especially those of us used to working with borderline personality. Self-control is what we're trying to teach these people. We want people to have more self-control. And if we think about it from an evolutionary perspective, self-control means that we weren't acting on every impulse. We weren't attacking people who may have accidentally knocked into us or lashed out. This is how we were able to work together as a tribe. So RODBT thinks about how we used to work together as tribes. And self-control was really helpful for that. Crocodiles, not so great with self-control, not so great with friends. Think about it like that. So under-controlled, from a, I suppose, behavioural perspective, I'll take a step back. Like I said, there's a lot of information about tribes if you read a lot of Tom Lynch's work. There's also a lot about temperament and a lot of neurobiological research, which I think is really fantastic, that there's a lot of more recent neurobiological research that's gone into some of the theories behind this. So it's not just presentation, we're actually looking at brain bits. Not my area of strength, so don't ask me about the brain bits. But if we think about how this comes from a temperamental perspective, these people have high reward sensitivity, global focus processing, low inhibitory control, and low threat sensitivity. So that's what under control is from a temperamental perspective. That asterisk next to low threat sensitivity is there because people with borderline personality have a high threat sensitivity. So we need to keep in mind that obviously these temperamental traits are going to get all mixed up together. So how this comes out is poor impulse control, very emotionally expressive, dramatic, disorganised, what we see in our stereotypical presentation. So we've often thought too much self-control is a really good thing. We're trying to have more of it. So this is the general theory. The more self-control you have, the better we're managing. From an RODBT perspective, we're saying, actually, there can be too much of a good thing over here. And so, as we said, most people in this room are likely to fit under the over-control area. We're not saying that everyone's up here, probably in this area somewhat. This is the healthy bit. This bit up here is the less healthy bit. From a theoretical perspective, right at this end up here is our autism and our anorexia, as well as those personality disorders that fit in under there as well. So I will use a couple of examples about anorexia. One, that's my area of interest, but two, that is, it's such a prototypical example of over-control as well.
Can I just interrupt? So
Yeah.
you said, and other personality disorders. What other, oh, you're coming to that. Okay.
That's coming, don't worry. So by definition, over-control is low reward sensitivity, high threat sensitivity, high inhibitory control, and high detail focus processing. So Anna already mentioned the detail focus processing, really, really good for doing well at work. I'm not so good with that. This is where, as much as a lot of my clients have said, you're so over control. I'm like, yes, I'm good at planning, I'll admit that, but I do not have good detail focus processing. My master's thesis had 4 typos on the first page when I got it back after proofreading it, I think, about 1 million times. And as well as that, I've got very high reward sensitivity, I found. I like everything, whereas that's less likely to come out. Yes?
How does culture fit into it?
I'll talk about that a little bit. And culture is obviously going to make it a little bit more complicated. I think there are a lot of cultures where over-control is a little bit more natural. We need to be aware that when we're treating something, we're trying to treat it if it's a problem. If it's not a problem in that cultural setting, then there's no reason to treat it, I suppose. That's a very short answer to it. Because I know that some cultures are going to be a little bit more under control by nature. Thinking a lot more of, say, South American cultures, for example. But there are a lot of cultures that are more over-controlled by nature. But if a person is fitting into that cultural and that cultural expectations, then we're not going to necessarily see that as a problem. Does that make sense?
It's a separate presentation.
Yeah, we could discuss this for hours, probably. Yes.
Sorry, just a little bit more about low reward sensitivity.
Yeah.
So it means they're hard to bribe. They're less impressed by, is that what that means?
Yes,
Yeah.
absolutely. So, and there's probably a lot of that, and it's probably another whole thing we could discuss for hours as well.
Sure,
But that low reward sensitivity, from a temperamental perspective, there's a big spectrum of reward sensitivity. Some people are going to get a lot more excited and enjoy things a bit more, whereas other people are a little bit more hard to impress.
Okay, and so does that, sorry if this is off the
That's
topic,
all right.
but does that mean that they're also harder to punish, or that's a separate issue as well? Like that,
Probably a separate issue.
It's a
That'll
separate
also
issue.
go if you think about the high risk sensitivity, which is also in there, the
So-
high threat sensitivity.
yeah.
That's then going to make them, I suppose, easier to punish because they're seeing more threats
Oh, sure, yeah. So,
in
yeah.
things, if that makes sense.
Yeah.
At this point of time, my gut feeling is telling me that people who have kind of temperamental kind of, I don't know, temperaments that are more towards under control, my gut feeling is telling me they might benefit more from RODBT. The thing is, because people who are born to be under control and they have been told to do self-control all their lives, they might have suffered more. So then when they get approached with RODBT, they would think like, wow, this is working for me. Whereas people who are born to be kind of over-controlled on a temperamental level, they might feel more comfortable being like, doing self-control. So my gut feeling is telling me people who are under control will benefit more. I'm just curious your idea.
Possibly. I mean, there is a chance that people with under control will probably like it more. Like people with over control sometimes definitely feel they don't fit with DBT, but sometimes like it because they're so good with distress tolerance skills anyway. It's like, I'm already acing this.
Yeah.
Whereas it's much, for under control people, it's so much more of a struggle. So I think that you're right, people with under control are likely to like this and will probably get benefit from it. I also heard at some stage in my training, somewhere jumbled up in all of that information, that some people have done Radically Open after they've done DBT, so people who are under control benefited from DBT, and we pushed them right up to the over control side of the spectrum and then had to bring them back a bit. So we have seen that happen. It's like, oh well, we've taught you way too much control, we need to bring you back a little bit more. So that's something that I've heard anyway.
Yeah.
So how this comes up is they're emotionally constricted, shy, risk-averse, socially anxious children, more likely to develop internalizing disorders. So here's some of Tom Lynch's work in regards to the older adult sample in the UK, so this might not necessarily be relevant to young female populations in Australia. However, it's a really interesting pie chart about how much is the over-control aspect of the personality disorders there. It's also important to note I've been doing a lot of reading lately about, there's a lot of overlap. I read a paper earlier about adolescents with borderline, and I think over a third also had obsessive compulsive personality disorder. So that's just going to confuse us more by saying you're a stereotypical over control and a stereotypical under control at the same time. But it's important to note that there are a lot more over control personality disorders.
I don't quite understand
Yes.
the chart.
Yes.
Because it's, okay, so you're saying 73%. So is that all the green?
Yes.
So the dependent's definitely not in.
Yes, I think it's a little bit like, we're not too sure exactly where the dependent people are fitting with this.
Right. But the paranoid is.
Yes.
Wow.
It's interesting because I think sometimes schizoid as well, but that's just my experience. Yes.
There's a question over here.
Oh, sorry, I didn't see you.
Just before you put the 73 up,
Yeah.
what was underneath that? Oh, avoidant, yeah.
So when you
Yes.
send out the PowerPoint, are we going to get both versions? So as we
You'll
get
probably
confused-
get that one.
So that'll hide the green behind that. So if we get both versions, is it possible?
I will try. Try to remember. But it's sort of written out here anyway. Which is a little bit less picture, a little bit more list, but the stereotypical over control versus under control dialectic.
Where does passive aggressive personality issues fit into all this? Is that just considered a trait of that can belong to any of those, or?
I think it'll probably depend on, off the top of my head, I don't remember all the criteria for passive aggressive personality, but it would probably also, I'll talk about that in a little bit. I'll mention a little bit about the presentation, because it is a little bit confusing. It's not just about diagnosis, it's also about presentation. So before we talk about how this actually comes out, I need to be aware that over-control is a really good thing. Desires to be correct, exceed expectations, perform well, as Anna said, it does well. It's essential for our tribal success. This is a good thing. Valuing rules and fairness, fantastic. Because I think that that's the thing. Rules and fairness are really important to these people. They will follow the rules. And they'll do what's fair. I think there was a good example of this. My colleague in Sydney, who's one of the other intensively trained people, we had the opportunity to do some training in RODBT. And I'm like, yes, I'll do it. And she's like, Tanya, that's against the rules. No, sorry. She's like, we'll get in trouble for that, Tanya. Oh, I didn't even think of that. I just got excited. But yes, playing by the rules now. Delaying gratification, as we said, really good. These are the people saving food. Those people who save their Easter eggs for that's them. And duty, obligation, and self-sacrifice. In your example, Anna, I really liked how your client, I go to social occasions because I should. It's the right thing to do. Very helpful. As opposed to, yay, party! It's more, I suppose I have to go. So a lot of this theory came from what's actually important for tribal survival. So we do need to bind together with people who aren't related to in order for tribal survival. So this is where a lot of the skills and a lot of the base comes from behind RODBT. I won't get a chance to explain it all, but I suppose I wanted to highlight that that's where a lot of it has come from. And as such, because it's pro-social, because it is about our tribal survival, over-control people, they're not the people roaming the streets in gangs. They're detail-focused perfectionists, and this is why, like I said at the start, we're more likely to see borderline in treatment because, and antisocial as well, because it's eye-catching. These detail-focused perfectionists, they're still at work. They're not coming to therapy. They're still at work. We're here out of work hours as opposed to going to meet our friends at the pub. No, so tend to work harder than most to prevent future problems. And we're very expert at not appearing deviant on the outside. And I think that this is important because in the case that Anna was talking about, there was so much aggression and violence. This person was acting in a way which you're saying, wow, there's violence, there's alcohol consumption, this sounds very under controlled. But I can imagine that people weren't able to see that. Her husband, her partner, seeing it a lot. Outside, not seeing it at all. She was probably not presenting as deviant or angry. And the best example of that is our prototypical example of anorexia. Very, very perfect on the outside. Their parents try to force them to eat. They see a very different side. So it's important to keep in mind that because these people are over control, it doesn't mean they're perfect and in the box and not expressing emotions all the time. These emotions will come out, but it'll be much more limited to where it's actually coming out, if that makes sense. So where this comes from, and so I'm talking a lot about over control and under control, but RODBT is actually focusing on emotional loneliness. It does all link together. It does take 30 weeks to link it together. So that's why it sort of doesn't seem like it links together on the outside. But over-control is a problem of emotional loneliness, and that's what we're actually targeting as part of RODBT. So low openness and social signalling deficits. So when we talk about social signalling deficits, it's the question, how are you showing this on the outside? So if we're talking about these emotional outbursts, what might you see you do? Chances are they'll say, okay, you won't see me do anything. It's all happening here, and then when I get home, I get out the bottle of vodka. And also, it's about asking about those social signalling deficits, and I'd love to hear about how your client goes to work. She doesn't want to make friends, she says, but if she did, you'd be asking her, do they know you want to make friends with them? Oh no. Sit in my office and wish they'd come in and talk to me. In this case, it sounds like she wishes they didn't come and talk to her, but that would quite often be the case, is we're not signalling effectively. So RADBT focuses on social signalling deficits and using some of that neurobiological research to do so. So sounds confusing, but it makes sense. So it's not necessarily a lack of social contact, but it's a lack of social connectedness. I've had a lot of very over-controlled clients who have friends. They'll go to these parties, but they will sit in the corner and not talk to anyone. Or they're the same friends that they've had since primary school and haven't made any, and they'll just go to the regular birthday parties that they're invited to with the same people that they've been going to parties for the last 25 years, and not make any more friends. So it's a lack of actual connection that we're targeting here, and it sounds really relevant to Anna's client as well. Not that much connection there. And it's a picture. So what we're actually trying to target in regards to RODBT are our 4 core deficits of over-control. So our lack of reciprocity and openness, so refusing to take on feedback, not wanting to engage in novel situations. So we don't like new and different, we like things to be the same. They don't like taking on feedback, which is interesting in Anna's case. You know, there's a lot of blaming. Not taking on, I might be doing something wrong. It's no, you are. They may not have been doing anything wrong, but chances are. Lack of flexible responding. So this is where a lot of that perfectionism comes up. Rigidity, which comes up a lot with these people. Lack of emotional expression and awareness. Anna said that her client was interested in learning a bit about emotions, but quite often these people have learned that emotions are bad. We don't express emotions, they're bad, which is why the emotions never come out, basically. And the lack of social connectedness and intimacy, so quite aloof in their presentation. All of these 4 combine together to lead to emotional loneliness, which is then what we're targeting. We're saying that this is what's leading to the depression or the anorexia or whatever it is that's going on. So we're trying to focus on the function of emotions. So this comes back to the tribal stuff. Emotions are what helped us communicate with our tribes before we had language. So as much as we've evolved as a society, our way that we communicate to other people has not. We can see, we can smile, we can interact. If we look at someone and they smile at us, we think, oh, they're friendly. If we look at someone and they go, I don't want to talk to them. I want to go talk to the smiling, friendly person over there. So as a result of this sort of evidence, we're talking about emotional expression, how signalling actually matters. And it promotes those social bonds, which are really important. So what we're trying to do, this is where the temperament stuff comes in. We're activating the neural substrates. Again, don't ask me exactly which bits, I can give you general examples. But we're trying to activate the neural substrates that help us to connect to people. Because if I'm sitting here like this, I'm not going to be connecting. It's about being relaxed, being open, more able to connect. So integrating that evolutionary neurobiological stuff into therapy. So in general, we're trying to decrease over-control, decrease aloofness, decrease loneliness, increase flexibility, increase openness, increase the expression to lead to actually being connected to people. And a big part of that, we mentioned that openness, being open to new information, being open to not so great feedback. So that helps us to be a lot more flexible, so the behavioural flexibility and openness there to take on that new information. Because how that leads to connectedness, it's really hard to be connected at work or with your friends if you're not doing anything new or you're not taking on what people might be telling you, whether that be verbally or non-verbally. So the key difference between this is we're not actually focusing on, where the diagnosis for us isn't actually the problem. For us, it's the emotional loneliness. That's what the primary problem is, which I suppose from an eating disorder point of view is a very different approach. We're not going to focus on the eating, let's talk about the connection, but it works. So I'll quickly run through the evidence. This will be on slides. It's also really easy to find. So there's quite a few RCTs out there, from particularly the work with older depressed adults, So, they exist. So we're finding quite positive results. Remission, don't know why that's cut off down the bottom. Quite a few other ones there. I'm not going to go through all the results, but again, we'll send you a copy of the slides so you've got some awareness of that. This was one that has recently been published. I don't have the more recent version, the actual published bit, but where they actually did a really big 30-week RCT on RADVT in the UK. There it is. So we're finding pretty large effect sizes for RADVT, and there is the evidence for anorexia as well. This isn't an eating disorder meeting, it's a personality disorder meeting, but I'd let you know that there is some research out there for eating disorders as well. And there's a case study as well. Again, RADVT doing better than DBT alone. There's just a bit of an update on all of the ongoing research collaborations. There's quite a few of them, which is really good to see. So you're probably going to hopefully hear a lot more about it over the next few years. And letting you know, and there is some RADVT training coming up in September. So Sophie Rushbrook was here last year. We hosted them. Anna came. There now, she's coming out, and I've got her in contact with Steve, which is an eating disorder service. However, it's a transdiagnostic approach, and she'll be presenting transdiagnostically. So even if you don't care about eating disorders, it's not going to all be about eating disorders. Probably going to be very little about eating disorders. The reason why I'm also alerting you to that is Steve hosts really good cheap trainings, but they're really well priced. I think it's only $200 or something like that for one day with someone who's involved with, works with Tom Leach really closely, so it's a bargain, in my opinion. And we also have the intensive, which I'm part organising, that's in Sydney next year. So it's really exciting that Tom Lynch is actually coming out to do intensive training, which is amazing. So if you have any questions about that, I'm one of the co-organisers. As such, when we send out the information, I'll also put in my email address as well as our social media information and all that sort of stuff. I have access to 10 really cheap places. Well, it's $2,700, which doesn't sound like it's cheap, but it's $1,000 less than the early bird. So,
Let me ask you,
yeah,
because you mentioned that you're coordinating, you aren't thinking of having it in Melbourne?
we decided to go with Sydney at this stage just because it's so little knowledge, and we needed to guarantee that we'd be able to get 80 people there. And when we looked at the one-day training numbers from last year, no matter how, it may have been my promotional skills, I'm not too sure, we got 20 people in Melbourne. They got, I know, it was really awkward. But they might do better at sea, I don't know. But they got 70 in Sydney, and they also got sold out in Newcastle. So, and there's 3 already intensively trained people in Sydney who have very big teams that they're convincing to come along. So
So you need someone with OC to help you next time.
I know. I thought my colleague in Sydney, I'm going to damn you and your OC. So it is in Sydney just based on, I thought that we'd be able to get better numbers there, because again it would be really awkward if we tried to organise this intensive and 20 people showed up. So we're hoping that we can get more people into Sydney, which is annoying for us in Melbourne, but hopefully if you hit me up with the links that we send out, if you get on one of the super cheap places, get a free, think about it as get a free trip, possibly. So if you're interested, but obviously there's a one-day training if you want to hear someone who's actually, an expert in it talk about it. Because I'm qualified to do small 1 hour, hour and a half presentations, not registered to do any of the big ones. But we have a website, got an email address, I offer, talks, small consultation, discussions, because I found RADVT has been so helpful, filling a really big void. Like I said, I love DBT, but DBT doesn't fit for everyone. And there are a lot of people who do present as borderline, who may not be borderline, or present as borderline and also have an over-controlled personality disorder at the same time. So I'm a huge fan of it. I've got a Facebook page, Facebook group, which is not huge yet because our community is really small. But I've got small, talks, video blogs, all that sort of stuff there on more information if you're wanting it. Also, when we email stuff out, there's a really great issue. The Behaviour Therapist Journal did a full issue last year, which was just RODBT. It's got like 6 or 7 articles. So it's not light reading, but it's fascinating reading, personally. I love it. So, a bit about Tom. So, on that note, I think I probably talked for longer than half an hour.